Filters can transform a person into an animal
or a beautified person of themselves.
Bigger eyes, thinner face, thicker lips. But some plastic surgeons are finding more people who want to look better on their selfies or request to look like filters on social media. 21-year-old Janelle Rosario is about to get a non-surgical procedure to fill her lips. She was inspired to look like Kylie Jenner.
Yeah, I did kind of do it to look good in pictures, just because I felt like when I smiled, my top lip kind of disappeared.
This isn't Janelle's first time. She had her lips filled once before.
So I'm making this small entry wound right here and just going like that.
This is Dr. Otto Plasek, a plastic surgeon who's been in the business for 23 years. His name might not sound familiar, but you may be familiar with his work. He was the plastic surgeon behind the real-life Ken doll. Janelle's lips are being injected by dissolvable fillers. According to Dr. Plasek, the filler is slowly and naturally metabolized by the body. It lasts about 6 months. The whole procedure lasts a good 20 minutes. This is Janelle's lips after an hour and a half.
I definitely think if you're considering any cosmetic surgery, you should maybe think about it, maybe wait about a year. If you still want it, then maybe it's something that you really do want and will really make a difference in your life, make you feel better.
Dr. Plasek says he's seen a trend in his patients.
So I would say 100% patients come to me saying, I'm looking at my camera or my selfie and I don't like my double chin. And we have new options for that. Now in the past, some of these procedures may have required major surgery. As we've evolved as a field, many of these changes can be accomplished non-surgically and with considerably lower risk than it was in the past.
Physicians are finding that selfies and filters can take a toll on a person's self-esteem. According to Dr. Neelam Vasi, director of the Boston University's Cosmetic and Laser Center, our society's obsession with selfies and filters can lead to Snapchat dysmorphia, or people wanting to get surgery to look like filtered versions of themselves.
This is a very important and alarming trend. I have seen this in my clinics over the past few years, and the trend is increasing.
A 2017 survey found that 55% of surgeons reported seeing requests to improve selfie appearances. That number was just 42% in 2015. Snapchat dysmorphia is part of body dysmorphic disorder, or BDD. BDD is a mental disorder and is defined as a preoccupation with a perceived body flaw, so much so that it interferes with day-to-day life. In this instance, Dr. Plasek gave us his medical assessment of what's possible.
No filter and filter, and clearly I look younger, and arguably most people would say better in this image. Now, what can be achieved? My complexion was smoothed out, so I could have laser hair removal on my face. Some of the lines are softened, so I could have filler in my nasolabial folds. My eyes are made bigger. That's not achievable. The number one danger is thinking that it's easy and risk-free.
BDD is really tough to diagnose. Is there a danger to do too much surgery? And how can you tell if someone has BDD?
Now, sometimes it's not always detectable. You can do a very complicated test. But the danger of not recognizing is that you may have somebody who is unhappy with surgery or continues to have repeated surgeries, either with one practitioner or with other practitioners.
But as a physician, isn't it beneficial to do more surgeries technically
Yeah,
as a
the
plastic
financial
surgeon?
incentive.
Yeah.
I say, well, the obvious is I want to get paid for what I'm doing.
Of course.
Okay, right, okay. But the other is I want a happy patient. I want you to walk out of here saying he was honest, because you go and tell your friends.
This doesn't mean that anybody who uses Snapchat or filters needs psychological care. But Vashi says physicians and patients need to pay attention to the risk.
I felt like a new person, honestly. It just made me feel good, fresh.
Janelle doesn't have BDD, and she doesn't see herself getting surgery anytime soon. For now, she says lip augmentation will be her only procedure.
If you really want to do it and you're going to be confident after it's done and everything, then I think you should go for it.